Welcome to our comprehensive guide on amyotrophic lateral sclerosis, ALS, a progressive neurological disease affecting the brain and spinal cord. This guide will cover essential aspects of ALS, including its symptoms, diagnosis, and current treatments. We'll explore how ALS impacts daily life, the latest advancements in research, and available medications, while also providing practical tips for managing the disease and accessing support, whether you're seeking information for yourself or a loved one. This guide aims to offer valuable insights into living with and managing ALS. Amyotrophic lateral sclerosis, ALS, is a disease that affects the nerves in the brain and spinal cord, leading to a loss of muscle control that worsens over time. It's also known as Lou Gehrig's disease, after the famous baseball player. The exact cause is unknown, but some cases are inherited. ALS often starts with muscle twitching and weakness in an arm or leg, trouble swallowing, or slurred speech. Eventually, it affects the muscles needed for movement, speaking, eating, and breathing. There's no cure for ALS, which is a fatal disease. Symptoms vary depending on which nerves are affected, but often begin with muscle weakness that worsens over time. These symptoms can include difficulty walking, tripping, leg or ankle weakness, hand clumsiness, slurred speech, trouble swallowing, muscle cramps, and twitching. Emotional changes like untimely crying or laughing can also occur, along with thinking or behavior changes. ALS typically starts in the hands, feet, arms, or legs, and then spreads. As more nerve cells die, muscles become weaker, eventually affecting chewing, swallowing, speaking, and breathing. Pain is uncommon in both the early and later stages, and ALS usually doesn't affect bladder control or the senses like taste, smell, touch, and hearing. ALS, or amyotrophic lateral sclerosis, affects the nerve cells, known as motor neurons, that control voluntary muscle movements like walking and talking. There are two groups of motor neurons: upper motor neurons, which extend from the brain to the spinal cord, and lower motor neurons, which extend from the spinal cord to muscles throughout the body. ALS causes both groups of motor neurons to deteriorate and die, preventing them from sending messages to the muscles. This leads to muscle dysfunction and eventual paralysis. For about 10% of ALS cases, a genetic cause is identifiable. For the remaining 90%, the cause is unknown, though it is believed to result from a complex interaction between genes and environmental factors. Researchers are actively studying these potential causes. Several risk factors have been associated with ALS. Genetics. Approximately 10% of ALS cases are hereditary, meaning a risk gene is passed down from a family member. In hereditary ALS, children have a 50% chance of inheriting the gene. Age. The risk of ALS increases with age, particularly between 60 and the mid-80s. Sex. Men are slightly more likely to develop ALS than women before age 65, but this difference disappears after age 70. Environmental factors linked to ALS include smoking. Smoking is a significant environmental risk factor, with women who smoke, particularly post-menopause, being at higher risk. Environmental toxin exposure. Exposure to lead or other substances in the workplace or at home may be linked to ALS, though no specific chemical has been consistently identified. Military service, military personnel are at a higher risk of ALS. Potential triggers might include exposure to certain metals or chemicals, traumatic injuries, viral infections, or intense exertion. Understanding these factors is crucial for studying ALS and developing potential prevention strategies. As ALS progresses, it can lead to several complications. Breathing problems. ALS eventually weakens the muscles used for breathing. People with ALS might need a device, like a mask ventilator, to help them breathe at night. This device, similar to those used for sleep apnea, supports breathing through a mask worn over the nose, mouth, or both. In advanced cases, some individuals opt for a tracheostomy, a surgically created hole in the neck that leads to the windpipe, allowing a ventilator to assist with breathing more effectively. Breathing failure is the most common cause of death in ALS patients, with half dying within 14 to 18 months of diagnosis, though some live 10 years or longer. Speaking problems. ALS often weakens the muscles needed for speech, starting with slower speech and occasional slurring. Over time, it becomes increasingly difficult to speak clearly, potentially reaching a point where speech is no longer understandable. Alternative communication methods and technologies can help. Eating problems. Muscle weakness can affect swallowing, leading to malnutrition and dehydration. There's also a higher risk of food, liquids, or saliva entering the lungs, causing pneumonia. A feeding tube can help maintain proper hydration and nutrition and reduce these risks. Difficulty swallowing can also make it hard to take in enough calories, necessitating dietary adjustments and supplements. Dementia. Some ALS patients experience problems with language, memory, and decision-making, eventually leading to a diagnosis of frontotemporal dementia. This form of dementia can cause significant changes in behavior and personality, complicating care and quality of life. Understanding these potential complications can help patients, caregivers, and healthcare providers better prepare and manage the progression of ALS. ALS can be difficult to diagnose early because its symptoms often resemble those of other diseases. To diagnose ALS or rule out other conditions, doctors may use several tests. Electromyogram, EMG. This test involves inserting a needle into various muscles to record their electrical activity, both when they contract and when they are at rest. It helps identify problems with muscles or nerves. Nerve conduction study. This measures how well nerves can send impulses to muscles in different body areas. It can reveal nerve damage and is usually performed alongside an EMG. MRI. Magnetic resonance imaging uses radio waves and a powerful magnetic field to create detailed images of the brain and spinal cord. An MRI can detect issues like spinal cord tumors or herniated discs that might be causing symptoms and sometimes reveals ALS-related changes. Blood and urine tests. Laboratory analysis of blood and urine samples helps rule out other potential causes of symptoms. High levels of serum neurofilament light in blood samples are typically found in people with ALS and can assist in early diagnosis. Spinal tap lumbar puncture. This procedure involves extracting a sample of spinal fluid using a needle inserted between the bones in the lower back. While spinal fluid usually appears normal in ALS patients, this test can uncover other potential causes of symptoms. Muscle biopsy. If a muscle disease is suspected instead of ALS, a muscle biopsy may be performed. A small muscle sample is taken under local anesthesia and analyzed in a lab. Nerve biopsy. If a nerve disease is suspected, a nerve biopsy might be conducted. A small nerve sample is taken under local anesthesia and analyzed in a lab. These tests help healthcare providers accurately diagnose ALS by eliminating other conditions and confirming the presence of ALS-related symptoms. Treatments for ALS can't reverse the damage, but can slow symptom progression, prevent complications, and enhance comfort and independence. A multidisciplinary team of healthcare providers can work together to prolong survival and improve quality of life. You have the right to choose or refuse any suggested treatments. To begin with, let's discuss medications that are currently available. Riluzole, Rilutec, Exservan, Tiglutic. Taken orally, it can extend life expectancy by about 25%, but may cause side effects like dizziness, gastrointestinal issues, and liver problems. Regular liver function monitoring through blood tests is typical. Edravone, Radicava. Administered via IV or as an oral liquid, it may slow the decline in daily functioning, though its effect on lifespan is unknown. Side effects include bruising, headache, and difficulty walking, with treatment cycles of daily doses for 2 weeks each month. Additionally, other prescribed treatments may address symptoms such as muscle cramps, constipation, fatigue, excess saliva, pain, depression, sleep issues, emotional outbursts, urgent urination, and leg swelling. Next, let's explore the various therapies that can assist with ALS management. Breathing care. As breathing muscles weaken, devices like mechanical ventilators assist breathing at night. Non-invasive ventilation via a mask or a tracheostomy for a more permanent solution might be used, with some opting for a laryngectomy to prevent food aspiration. Physical therapy. Physical therapists help with pain, mobility, and equipment needs, promoting low-impact exercises to maintain fitness, strength, and range of motion. Stretching helps prevent pain, and devices like braces, walkers, or wheelchairs may be recommended. Occupational therapy. Occupational therapists assist in maintaining independence with hand and arm weakness through adaptive equipment for daily activities and home modifications for better accessibility. Speech therapy. Speech therapists teach techniques for clearer speech and alternative communication methods like smartphone apps or alphabet boards. Voice recording for text-to-speech applications may also be considered. As we conclude this comprehensive guide on amyotrophic lateral sclerosis, ALS, we hope to have provided valuable insights into understanding and managing this challenging disease. From its early symptoms and complex diagnosis process to the various treatment options and therapies available, we've aimed to cover the critical aspects of ALS. By exploring the impact on daily life, advancements in research, and available support systems, we hope to empower patients and their loved ones with the knowledge needed to navigate ALS. Remember, while ALS remains incurable, the right care and support can make a significant difference in quality of life and overall well-being. Please click on the next video for more Live Good info. Thank you very much.